So we've done all our grooming and our upkeep. We've done all our maintenance. We taking our probiotics. We making sure that pussy's dry. We making sure that pussy clean, trimmed up, shaved up, waxed up, pussy great. Now we want to fuck. First, lubrication. Your vagina naturally produces lubrication, discharge, etc. when it is aroused. But there are some women who are more wetter than others, and that is okay. Sometimes it just depends on how your body is made up. Sometimes it depends on your partner. Sometimes it depends on your diet. But lubrication is highly important to a sexually active coochie. So if your body is not producing as much lubrication as you would like, there are things that you can do. When it comes to supplement use to help with vaginal dryness, that's not an instant thing. You're not going to take this supplement right before you fuck like Viagra and then coochie is moist. These are things that you have to add into your grooming, upkeep, and maintenance regimen. That way that your coochie's always ready. This is if you want to go through the natural alternative. There is evening primrose. Evening primrose, it can come in a supplement or it can come in a tincture. There is maca root. There is red clover, red raspberry leaf. Fish oil, there are fish oils, omega-3s, vitamin E, vitamin D. Those are all things that you can add into your upkeep and maintenance to help with the lubrication side of vaginal sex. But if you need an instant fix, there are lubrications that you can get to use during sexual activities. If you are allergic to latex, please go the water-based route or coconut oil route. I would not do coconut oil if he is allergic to any type of nuts or if you do not know that he is allergic to any type of nuts or coconut. So I would suggest just go with the water-based just to be safe in case you have any allergens and he has any allergens. The only reason I suggested coconut oil because coconut oil does have natural antibacterial properties in it and it is healthy for you to ingest and put in your mouth if it came to you doing oral after you did vaginal sex. But there are some risks involved if someone is allergic and you just don't want to have to deal with that. So it's best to just go with the water-based. There are a lot of water-based lubricants that you can use and you can use it during sex. There's no shame in using lubrication during sex. If you already know that you're a little bit drier, if you already know that this is how your body is set up, have it ready, have it prepared. Have it prepared. It is okay. You can add it on discreetly. You can excuse yourself. Or you can do it right in the moment because honestly, y'all grown. If he is entering your body, there shouldn't be no shame that you have with what it takes to get your body ready. If you have the lack of lubrication when it comes to being sexually active, you can cause microtears inside your pussy that can also breed infections. Due to all of that friction with no lubrication, it could cause a lot of issues in this area, discomfort in this area, swelling in this area. So lubrication is highly important. Make sure you stay hydrated as well because that also comes into factor. If you're not drinking enough water and your body's taking all the water that you need to have all of the natural function that you have, ain't nothing gonna be left for your pussy. So make sure you drink your water. Diet plays a huge role in the pussy lubrication as well. And it also plays a huge role in the pussy smell as well. If you're eating foods that are highly fishy, highly this, it will take on in your discharge. So keep that in mind when it comes to the lubrication side of things. Lack of lubrication is completely normal. It is not just tied to the arousal side of things. It's tied to birth control, antidepressants, medications, lifestyle. There is no shame in having to use a water-based lubricant to ensure you are having fun, ensure you are feeling good. You don't want your pussy swollen and beat up and because you were dry and he was forcing you. When you have the lack of lubrication and those microtears happen, it can increase your chances of having STIs and it can increase those STIs from progressing into more severe things. So that is the huge reason why lubrication is so important. That is direct bloodstream access. You do not want to have cuts and tears inside that area. You can't access that area. Another thing to keep in mind with the lubricants, in case someone is using condoms or other different types of contraceptive with these lubricants, water-based, the one that I suggested to be on the safe side, that is best for condom use because it will help it not break. So if you are using condoms, please go with the water-based. Silicone base is best used for toys. Best used for solo play. It lasts longer, it's more slick. So it's good for that toy where sometimes you may not stay as aroused as you would if you had another person with you. Oil base, it is safe for you to ingest. Sometimes it is safe for you to use. It does help with certain penetration, but there's that allergy factor, and then it's not always compatible with condoms, so you're having that lack of protection factor, and then also it can fuck up your pH. When it comes to me, it's safe for me to go water-based. We're going to talk about protection and contraceptive methods, condoms, dental dams, those type of things are the only methods that protect against pregnancy and STIs. They are the only methods that protect against those. Birth control does not protect you from STDs. No method is 100% effective, of course. Shit, the condom, I think, is 86%? Something of that nature, maybe 90. There's always a chance, even with an IUD, is 99.99%. So there is no method that is 100% foolproof for STD or pregnancy, but barrier is the most effective and the only one that is essentially for both. So you choose what method is best for your lifestyle. If it is not convenient for you to use condoms, it's not efficient or affordable for you to use condoms all the time, use a method that works for you. It may be better for you to get on birth control. You like the ease of being able to be spontaneous and do what you do. That's something for you to talk about with your doctor to find the best birth control method for you. There's also natural birth control methods like the basal thermometer and cycle tracking to help you prevent pregnancy. There is no method that is 100% effective. Even the withdrawal method, I think, is 82% effective when it comes to pregnancy. It is not effective when it comes to STI because it is bare sex. Find what works best for your lifestyle. I really can't tell you what's best for you, what's not best for you. It is all an individualized thing. And it's also a relationship thing. There are a lot of my women who are married and they are not using condoms with their husband, which, you have every right not to do that with your husband. Find what works best for you. Withdrawal may be best for you. Cycle tracking may be best for you. Depo-Vera may be best for you. IUD may be best for you. All of those things. Do what is best for you. If you do decide to do the withdrawal method and you're having raw sex, the acidity of semen is 7 to 8 on the pH level, which is much higher than the 4 to 5 range for the vagina's pH. So if you are getting ejaculated in, there's going to be a period after you have sex where you may exhibit BV-like symptoms because that immediate rush and difference of pH level, you're going up 2, 3, 4 levels. So keep that in mind, and that's why it's always important to urinate after sex, wash up. So we go right back to number 1. If you get ejaculated in, you're doing the withdrawal method, you're having unprotected sex, we're going to emphasize on 1. Testing. If you are sexually active, even if you go spells without being sexually active, there are STDs that can stay dormant in your body for years. So please make sure you are getting full panel, because if you just ask for standard panel, they're not going to test for every single thing. You have to specify these things when you go to your doctor. It's crazy. It's crazy. Why wouldn't they just test for everything? You're already taking the shit anyway. I'm not telling you every 3 months. Maybe every time you get a new partner. At least every year. At least. If you are with somebody for a long time, just because you are with one partner does not mean that they was only with you. I'm going to just keep it real with you. You have to protect yourself. There's a lot of women who think that they are safe because they are in long-term relationships. You're never safe. You're never safe. Like I said, things can be dormant in your body for years. Get tested. And if you are scared to get tested at a doctor's office, There are testing services that are completely online and virtual. There is no excuse. There's Planned Parenthood shit. They fighting to keep Planned Parenthood open. They need motherfuckers to come in there. They thinking about doing peptides and shit at Planned Parenthood to keep the bitch open. Go there and get tested. Go there and get tested. And I know you're like, well, I get a pep smear, JL. Ain't they testing when they do the pep smear? They take a culture sample and they're testing for abnormal levels to see if you have a potential to have cervical cancer. But the GAG pep smears do not test for ovarian cancer. That's the cancer in your ovaries, which a lot of women can be affected by. You can get your pep smear every year or 3 years or whatever the fuck they try to tell people now. I do it every year. They try to tell some women that they only need it every 3 years. Make sure that they test you for ovarian. Ask your doctor that. When they're giving you your pep smear, say, what tests do you all test for with the pep smear, with that culture? What is everything you test for? And if ovarian is not one of them, make sure they test you for ovarian. That can help you with early detection. That can help you see if there's any issues with your ovaries. So make sure you're asking these questions when you go to the doctor. Make sure that if they are taking something from your body, if they're taking a culture or a sample, you're getting as many answers as possible for one swipe. Next, when it comes to the sexually active coochie, like I said, when you're wiping front to back, you won't fuck front to back. So if you start in coochie land, you can end in booty land. But you're not going to go to booty land, then put it in the coochie. Never ever do that. I don't care how drunk and freaky you are. Don't ever let that nigga put booty dick in your pussy. I don't care how freaked out and fucked up you was. No. The bacteria in shit, the bacteria that is in your ass, rectum, anus, etc., put it in your pussy. That is a one-way fast track ticket to a UTI. Fast track ticket to BV. Fast track ticket to yeast infection. Was that freak nasty booty land to pussy land night worth it? Now you got 7 days of metronidazole. No. We end in booty land. We end in booty land. Booty land's the last stop for a sexually active coochie. So some things that I may have forgotten when I touched on lubricant. Spit is not lubricant. It's not. There is a lot of bacteria in spit. People can have STDs in spit, which I know, you already kissing them, they put their mouth on you, so it's already down there, but still, he might have a cavity in his mouth, and you putting cavity spit on your pussy. Spit is not lubrication. Spit, you're going to have to keep reapplying. You're going to have to keep spit shining your pussy, and it's not effective. You might as well use lubricant. How you more embarrassed to pull out Astroglide than to have that nigga hot tooing on your pussy all night because it keeps drying up? No. Go with the lubricant. Outside of the natural bodily functions that cause lubrication, emphasize on foreplay. Foreplay and pre-foreplay is your best friend when it comes to a sexually active coochie and it comes to a well lubricated coochie. So take your time, sister. If you need a little bit more time warming up, if he need to do a little bit more licking before he starts to sticking, communicate that. Greatness don't happen overnight. Don't let him rush you. Your pussy works at your own pace. Let it work at your own pace. If you need more foreplay, communicate that because it's going to lead to a better sexual experience with your coochie. Last but not least, before I move on to the next section of the Coochie Commandments, listen to your body when it comes to the sexually active coochie. If sex is causing a lot of pain, it's uncomfortable. Truly uncomfortable. It's not that you are disassociating. It's not that you are having a mental block. It is truly uncomfortable. You are flinching every time he goes into the entrance of your vagina. Speak up and advocate for yourself, whether that be with your partner or with your medical team. I am not saying that it is not normal to sometimes have these feelings, but to always have discomfort with sex, it may be an underlying issue. So don't overlook those things. Don't bear through it and just brave through uncomfortable sex because you want to please your partner. You deserve to have a sexually active coochie that is fun for you. You deserve to have a sexually active coochie that is pleasurable to you as well. So speak up if any of that ever happens. The excessive dryness may be linked to some of the medicines that you're on, or maybe some of your lifestyle things, or it may be an underlying condition. The excessive infections, the weak pelvic floor, not being able to hold urine, all those things. Please communicate with your doctor. Please figure out what the underlying issue is and don't have your man fucking through the pain. Next, coochie aftercare. So we didn't groom the coochie. We was maintaining the coochie. Now we didn't let Mr. 7-8 pH level penis nut up in us and fuck us real good. So now we need to take care of the coochie. We need the aftercare for the coochie. After you finish getting fucked down to the flow, I know you want to go to sleep. I know you huffing and puffing tired. You need to wash your ass. You need to drink something. You need to eat something. You need to smoke something. Go pee. Go piss. You know how when I showed you where everything is, how that urethra, where we urinate, is at the top of the opening of the vagina. It's in that same area inside the inner labia. Because you had that nigga digging, that hole stretched up. He damn near rubbing on your urethra. His dick and the juices and everything, the bacteria, y'all juices swapping and shit. It's all in that hole. All covering it up. And you know, if you don't piss after that, you just letting it build up and breed up in your urethra. And it's going right to your bladder. Right to your bladder. UTI land. If you don't do anything after you finish fucking, go take a piss. You'll save yourself a lot of trouble in the end. After you take a piss, if that nigga was a gentleman or a gentlewoman, they would give you a washcloth. I'm not saying that you need to jump right in the shower. You got to do your whole 1-2. You got to put the cornstarch powder. You got to put the witch hazel. You got to dry your pussy off. You got to do all that. I'm letting you know, after you piss, wash her off. Wash her off. Don't go to sleep with a wet ass. Don't go to sleep with your juices, his juices, all y'all juices, his hair and everything, all in between your legs, marinating all night. I know it is hard. I know sometimes it's tempting. I know sometimes we go right to sleep. But at the very least, if you know that's how you get down, try to have it on a nightstand ready for you after you finish fucking. So all you gotta do is just grab that bitch and wash her off. If you are just sleepy, you got fucked down to the floor, you gonna go shower in the morning, whatever, because he gonna fuck you again in the middle of the night. Get the warm washcloth. Wash your area. We're going to wipe off our sides. Anywhere where his body and his skin was touching your skin, we're going to wipe it off. So we're going to wipe off that ass crack. We're going to do the ass crack last because, like I said, we don't want to rub in the booty juices on everything else. Inner thighs. Outer labia. Inner labia. Urethra. Vagina. Anus. We're going to wash it off with warm water. Just at least. We're going to refresh the pussy. After you fuck, I know you probably had some tight ass leggings on when that nigga came over. Don't put it back on. Loose clothing. After you done fucked, after you done pissed, after you done washed off with the washcloth, loose fitting clothing, your muumuu, your nightgown, your robe, shit, you ain't gotta have nothing on, just cock them motherfucking legs open. You need to let the coochie breathe after it's been penetrated, after you've had a lot of sexual activity. You need to let that coochie air out. Don't smother that coochie because, for one, depending on how you fucked or if he came inside you, you're still going to probably have some type of moisture or discharge even after you piss, even after you wash yourself off, even after you put on the loose-fitting clothing. You may still have some, so we want to air it out and give it opportunity for that coochie and that vaginal canal to do what it do, which is clean itself. Next, let's say that you sexually active, but you weren't sexually active with a person. You were sexually active with yourself or toys. Clean your toys. Don't you dare put that crusty ass rose from 5 nuts ago on your pussy today. Wash your fucking rose off. Wash your bullet off. Wash your sex toy, your dildos off. You wondering why your BV, you wondering why your yeast infection, you wondering why all that shit keeps coming back, and it's because you fucking yourself with the toy that you had while you was infected. Wash your toys off. That's like that nigga fucking you and not washing his dick after he just fucked somebody else or after he done just rolled around all day and been working all day. No. Clean your toys. There is toy cleaner, or you can use your feminine wash. Run that bitch under some water, put a little squirt of soap on her, and go about your business and let that bitch dry out. But do not let crust and discharge build up on your toys. You can pass someone else an infection by using unclean toys. Never share your toys without cleaning them. Next, if you have the option to, I know some of y'all freak a leak. You got the in-house. You got a nigga who want to fuck you tomorrow, and the next day, and the next day, and the next day, and the next day. Coochie don't get no breaks. Coochie working 7 days a week, 365. So you may not be able to do this, but if you are dealing with somebody and you ain't got no in-house and y'all have the luxury of waiting a couple days between when y'all fuck again, use that 1 to 3 days or 1 to 1 week or whatever much time that y'all have to listen to your body and look at your body to make sure you're not having any changes. So, watch for changes. Watch to see if your discharge consistency changes. Watch to see if the smell of your vagina changes. Watch to see if you develop any bumps or discomfort, or if you have discomfort in your vaginal opening, if that doesn't cease, if it still is persistent or is getting worse. You watch your body at this time to make sure that there has been nothing that is coming to your system or any STIs, no infections, no STDs, and that sort of thing. If you can't keep on waiting, or maybe let's say you waited 2 or 3 days and you're starting to see some changes, you're starting to see something. Get those test strips. I think you can get 60 of them for $10 on Amazon. 60 test strips. They're like this long. It's just literally, it's like a little small test strip. You rub it right there. 5 seconds, it lets you know what your pH level is. So if you don't want to wait, check your pH level. That'll tell you. It's not going to tell you if you have an infection per se. It's not going to tell you exactly and diagnose you or what you have. But it is going to give you an idea if your vagina is not on the pH level or if it's too acidic at that moment. And that is an indicator that possibly the partner or the type of sex that you guys did, or maybe you guys went from booty land to coochie land, etc. It's going to tell you where you probably went wrong in your step 1 or 2 process. If you have sex that was really painful, don't be afraid to add a cold compress. And I'm not saying sex is just painful due to the lack of lubrication. There are some penises or some sex toys and that sort of thing where it can cause a little pain to that area, a little bit of swelling just naturally in that area because you constantly smacking skin on it, going wall to wall, balls to wall. Cold compress. Take you a little ice pack. It's okay. He beat that motherfucking pussy up. Put that ice pack right there. Another method that I've heard some women do, they take like a towel or a washcloth, and they will roll it up kind of like this. They'll put it in that area and have some pressure on that pussy, because pressure helps with the swelling. So if he really did beat your pussy up, put some pressure on her or put some ice on her. I'm not trying to be funny. This is true. There are also some products out there. There's some salves and some creams and stuff that help with it's basically like an oil-based kind of salve or cream that you put on your vagina that helps heal it if you have some small tearing or if you have some swelling due to a larger partner or rough sex. There are those products out there, but I am not sponsored by those products and I don't personally use any of those products, so I can't necessarily refer any, but you can do your research out there to find any salves that help with rough sex. Aftercare also includes your partner. You have that oxytocin and those chemical reactions that are running through you. You just had that dopamine boost, all of that happening to you at once. So thrive in that, feed in that, cuddle, be held, have safe place. Let's say even if he is gone, he can't hold you or cuddle you anymore. Retreat back to a safe place. Retreat back to comfort. Find things that make you feel comfort so you can relax after having your release of being sexually active. That is very important. Support that chemical response. The last Coochie Commandment, we are talking about overall coochie health. So it's going to have a mix of all these other 3 Coochie Commandments, but this is for the long-term health of your pussy. I'm going to go ahead and bust the myth again like I did in the first chapter. Coochie's not supposed to smell and taste like roses. Coochie's not supposed to smell and taste like sugar. Coochie's not supposed to smell and taste like strawberries. Coochie tastes like coochie. Coochie smells like coochie. Coochie has a natural smell, a pheromone smell. Sometimes your body smells different than how my body smells. Every coochie has some type of smell to it, even if it is mild and healthy. As long as you know your baseline, what your coochie smells and looks like when you are up to par, when your maintenance and grooming is in check, when your doctor's appointment's in check, and you know your coochie baseline, that's what you need to go off of. These are warning signs when it comes to overall coochie health. So I said coochie is not odorless. I didn't say that it smells like fish. I said it has a natural musk. It can be mild. It can kind of smell a little yeasty. It can smell a little bread-like. Fishy's not one of them. If the coochie has fishy smell, that bacteria is starting to change. It's a little bit more milky. It's a little bit more consistent, or a little bit more excessive. It's more grayish. It's starting to burn, itch. You have an irritation. That's a coochie red flag. That indicates that that's a problem. That's not your baseline. Go to the doctor. Bacterial vaginosis is very common. Almost every woman will experience it at least once in their lifetime. And it is not always tied to sex. The coochie can get its pH knocked off in the grooming, in the upkeep, in the maintenance, with the products you use, or the lack of products, with the lack of drying, with the lack of showering, with the lack of grooming, with the tight clothes, with the not pissing, with the not using protection, a barrier method. There are so many ways. Diet. Anything that knocks your pH can cause BV. If you have BV, stop covering it up with boric acid. Boric acid does not get to the root of BV. It just helps with the symptoms. You basically have BV, but the boric acid took away the fishy smell. Think of it like that. Antibiotics. There are multiple methods of antibiotics when it comes to BV. You can have an oral antibiotic, metronidazole. I'm not sure if I'm pronouncing that correctly, but Metro. 7 days, 2 tablets, 1 in the morning, 1 in the evening. No alcohol while you are on this. If you have alcohol while you are taking this antibiotic, it 1 can make it not effective. 2, it can make you develop ulcers. 3, it will make you vomit. It can make you have migraines. It can cause you a lot of issues. It can cause you dizziness, those sort of things. Do not mix alcohol with your antibiotics. You're going to have to stop drinking for that week. You're going to have to stop fucking for that week too. It's for the overall big picture. There's also other methods when it comes to the antibiotics for BV. You can do a vaginal suppository. There are some that are, I think, 3 days, and there's some that are 7 days, or I think one is like 5 days and 7 days. Either way, you still don't want to mix it with alcohol. You still don't want to mix it with sex. You still want to make sure you're giving your coochie a lot of time to heal. This is another thing why you don't want to introduce sex or sex toys or anything like that when you're going through this healing process, because you also want to go through that process of elimination. If you add in shit in while you're healing, you're not going to truly know the root of why you got this BV. So you want to get yourself back to your baseline and figure out where is the trigger for you. If that discharge starts to get lumpy, cottage cheese-like, is usually a yeast infection. The shitty thing about yeast infections, you can develop a yeast infection after you just treated yourself from BV, because what happens is that bacteria, your flora is off. It can cause an overproduction of yeast, which can lead to a yeast infection triggered by the antibiotics. So there are a lot of times where your doctor may prescribe you the Metro or some pills or suppository for your BV, but also tell you after you finish to take some Flagyl or a different yeast infection medication to prevent you from getting a yeast infection from the antibiotics. Sometimes they go hand in hand. Just like BV, a yeast infection is not always done because of a sexually active coochie. There are other things that can contribute to the overproduction of yeast. Like I said, that grooming and upkeep and maintenance is a huge part of having a strong, healthy flora for your vagina to thrive in. Yeast infections are treated with an antifungal. They're not a bacteria infection. So that is the difference between the two. A lot of times with the yeast infection, it will have the pill. I think it's a single pill called Flagyl, or you can get a vaginal suppository that you will put in. Sometimes they have a 2-day, sometimes they have a 3-day, sometimes they have a 5-day, and you will use that antifungal to get rid of your yeast infection. Same, you do not want to have sex while you are inserting a suppository or medicines or ingesting medicines. You want to make sure that infection clears all the way up. So like I say, so you know where you went wrong in this process. Green discharge, green, deep yellow, lime colored, along with odors, along with itching, along with discomfort and burning and irritation, that usually indicates an STD or an STI. You mandatory have to go to the doctor. There are online and virtual services available to test and to screen and to prescribe you with medications. But like I said, you have to seek a medical professional. Untreated STIs and untreated STDs can lead to cancers. They can lead to greater issues. If you are seeing green colored, yellow colored, lime colored, foul smelling discharge and uncomfortable irritation, go to the doctor, get antibiotics. A lot of these STDs and these STIs, the medical system is so advanced now where you can literally take a couple antibiotics, you wait a week or so, and you're back good. Make sure if you ever get infected with an STI or an STD that you communicate to your partners. Rather, you feel like that they gave it to you, or you feel like you may have given it to them. You need to have that communication so that they can get themselves clean, so they are not becoming a spreader to whoever they decide to be partners with. Communicate that. Have that conversation. I know a lot of times if you do not want to have that conversation, and it gives you some anxiety to have conversations like that, I think that there are even hotlines that you can call that will do those calls for you. I wouldn't have any shame in that. It is natural. If you guys had unprotected sex, the risks were there regardless. So have that conversation if you feel like that you may have spread something or someone may have spread something to you, just so everybody can get treated and be safe. You do not want to get reinfected. You decide not to tell him because you think maybe it was something that you did. You was fucking with another nigga, but you didn't got him infected. You keep fucking this other nigga and now you didn't got it again. Communicate to your partners if you have an STD or an STI, please. If you have burning while you're urinating, yes, that is a symptom of an STD, but that also can be a symptom of a UTI in your urethra. So please get that checked out. You will need antibiotics. You can take some cranberry supplements in your grooming and upkeep and maintenance side of things to help prevent those things. But once you have a UTI, the cranberry is not going to take it away. Do not tough out a UTI. Do not let it linger. Like I said, that urethra is directly tied to your bladder. If you leave a UTI untreated, you can not only get an infection in your bladder, but you can also develop an infection in your kidneys. You don't want that. Go ahead and get it treated. Don't tough it out. Listen to your body. If you start getting bumps, lesions, warts, and you know that they are not razor bumps. You know it is not because you are shaving your pussy. If they are in clusters, if they are in chunks and it is burning, uncomfortable, leaking, flag it to a doctor. Go ahead and get a culture sample. Go ahead and get tested. I think they say over 50% of the population has some type of herpes virus. With that being said, it is very, very common that you may run into a partner that may be carrying that and may be asymptomatic, and you may not be. Flag it to your doctor. Make sure that it's not an ingrown hair. And then on top of that, look at your body. Look online. I am not saying that you will diagnose yourself based off of what you search on Google, but it would kind of help you see if what you looking at on your pussy resembles what you seeing offline. And that way, when you go to your doctor, you're a little bit more educated on the topic. Not only with the bumps, bleeding outside of your menstrual cycle, skipping periods, not having consistent menstrual cycles, flag it to your doctor. There are some women who naturally have irregular periods, but you want to know the why, and you want to know if that is naturally how your body is set up. You do not want to push that off. You don't want to delay it. There can be an underlying condition, and it also can indicate an STD if you are bleeding through penetration or after penetration. So check it. If you have severe pelvic pain after you have sex, check it. That could indicate possibly pelvic inflammatory disease, HPV, all different types of things. Please get that checked. HPV left untreated, pelvic inflammatory diseases left untreated can result into cancers in women. So please do not delay that. If your lower stomach and your pelvis is hurting, in constant pain during sex, after sex, not having sex, talk to your doctor, sister. To stay ahead of these things. I know a lot can happen between appointments, but make sure that you are going to consistent gynecology screenings. Like when you get that pap smear, make sure that not only they're testing for cervical cancer, but they're testing for ovarian cancer. They might end up telling you that they have to take a different culture sample, or they have to do a separate test, or maybe that your insurance doesn't cover it or whatever, but you want to go ahead and know those things so you can stay informed on your body. You don't want to, oh, I've been having these pap smears, I've been having pap smears, what happened, and then you get a diagnosis, but you never tested for that. You've left it untreated for years. So stay on top of that. Ask questions, sister. Don't just take anything for what they say is your word. You know your body better than anybody, and you have to advocate for yourself. So do that. If you had the HPV vaccine as a teenager, I had it's called Gardasil was one of them. I think that's probably what it's still called to this day. Maybe it's called something different, but back then it was called Gardasil. And Gardasil does help prevent most strands of HPV. It is not 100% effective because nothing is 100% effective, but it is highly effective for preventing HPV and preventing the HPVs that develop into cancer. So if you are a young girl who is watching this, or maybe a teenager, or maybe you are someone who has not had that vaccine yet, talk to your medical team about possibly getting the Gardasil or the HPV vaccine to help prevent your chances of developing HPV or cancers that are developed from HPV. Sugar in diet matters. Like I said, if you are having a diet that is high in fish, high in sugar, high in crab balls and junk food and shit, it will fuck with your sexual health and fuck with your vaginal health. Sugar breeds yeast. You eating candy and drinking liquor all the time and wondering why your coochie so fucking creamy. All them daiquiris are feeding the yeast in your pussy. Cut back on the sugar. That's why I said don't put no sweet shit down there. Don't put no honey, no powdered sugar, no nothing. I know them bitches try to tell y'all tricks to how to make your pussy taste like sugar. No. Sugar breeds the yeast. Yeast breeds the infection. Hormone changes. Hormone changes are natural. They can develop through your different phases. They can develop through pregnancy, menopause, premenopausal, all of these different things. Hormonal changes can also mean that there is an underlying condition, possibly PCOS or things like that. Please how please advocate for yourself. Look up your symptoms. If you are growing hairs, I think they had said when I got diagnosed with PCOS, I went to the doctor and she said, "Are you plucking more than 10 hairs a week off your chin?" I said, "Yes, I am." She said, "You have PCOS." Women shouldn't be growing a beard. There's an underlying condition. You are possibly developing too much estrogen or not enough estrogen, or maybe too much testosterone. There are different supplements that you can do. You also probably may be insulin resistant. You may have to change up your diet. That's why I say diet plays a large part in vaginal health. So if you do have PCOS, you likely are insulin resistant, which means that you probably need to have a higher protein intake, a lower processed food intake, a lower sugar intake, a more balanced and cleaner diet. You also probably need to start taking spearmint tea in the mornings because that helps support hormonal balance. And then also another supplement that has been helpful for me is saw palmetto. Saw palmetto is usually something that men take for testosterone support and testosterone balance. A lot of women, when we produce too much testosterone, some people suggest us to take saw palmetto to help balance that out. And it's been effective for me. Like I said, I am not a doctor. This is just things that I have researched because I would rather heal myself as natural as possible while having medical advice and medical supervision than to highly medicate myself and possibly make things worse. Because like I said, all of those antibiotics and those medicines can affect the vagina even worse. Shit, I just had hair on my chin. Now my shit dry as fuck. I'd rather have the hair. Pelvic health. Pelvic health is coochie health. So practice those Kegels. Clench that pussy. I've been clenching my pussy the whole time while I've been teaching. The whole time I've been teaching. Do exercises that help your strength. Do exercises that target core strength as well. A healthy pelvis is a healthy pussy. If your pelvis is weak, a healthy pelvic floor is a healthy pussy. If your pelvic floor is weak, you'll have issue when it comes to urination. You'll start to have pain during sex. It will overall affect your entire intimacy and sexual health. So please make sure that you are supporting your pelvic floor and incorporating exercises to keep yourself healthy. I know a lot of these suggestions, when I brought up the red flags when it comes to overall coochie health, I was just saying, like, at the end of the day, you will have to go to a doctor. There are some things that you can heal at home. Like I said, when it comes to me managing my PCOS symptoms at home, I do a lot of targeting with my diet, trying to stay active when it comes to not doing super high intensity interval training because that can increase your cortisol levels. But I like to do a lot of walking, a lot of slow movement, slow intentional movement, a lot of stretching, a lot of yoga. Find what works for your body. But I did find that a lot of height training will induce my stress levels and my cortisol levels, which will actually end up working against me instead of me having more slower intentional movements. If you have a very mild yeast infection, there are some over-the-counter medicines that you can get. But if you are not seeing progress after you've taken your doses, please go to your doctor. Don't keep buying and spending money on over-the-counter things when you need a prescription. The same with the bacteria vaginosis. If you are just using the boric acid and you keep seeing this come back, you keep seeing it reoccurring, you are not getting to the root of your problem. So you need to go to the doctor and get antibiotics. Do not chronically self-diagnose yourself. Yes, the internet is a resource tool. Yes, you should research so you can advocate for yourself and so you can speak fluently about some of the things that you've learned. You can bring things up to your doctor, but do not strictly diagnose yourself off of Google. Please go to a medical professional. Stop letting things linger if they are affecting your coochie health in your day-to-day. All of these things that I listed go to the entire picture when it comes to coochie health. Not even just diet, smoking, drinking. If you're smoking a lot, especially if you're smoking weed, it can fuck with the flora of your vagina. It also can cause dryness. If you think your mouth is getting cotton, you think your pussy's not going to get cotton too? All of those things matter. So that's why I say hydration, diet, regular doctor's appointments, listening to your body are so vital to having a healthy pussy. I'm going to go ahead and close this up because I have touched on everything in my Coochie Commandments. But like I said, ladies, please advocate for yourself. Please communicate with your care team. Please listen to your body and listen to yourself. Understand what your baseline is and your normal is. Understand what it looks like to have a healthy pussy. And that is what you should always mirror. And that's what you should always use as your reference guide whenever you think something's wrong. Because you know what it felt like to have your pussy A1. But I am Dr. JL Swallows, and this is the Coochie Commandments. The owner manual, the official, unofficial Coochie Owner's Manual. I just want to say I appreciate everyone for supporting me and everyone who watches these and everyone who is just, oh my God, I love y'all so much. I love y'all so much. And I just appreciate you guys like letting me use my voice and letting me advocate and letting me even do all this. Like, I love y'all. I want y'all to have healthy, happy pussies. And until next time, if you have any class suggestions, if you have any tips that you'd like to share, anything else that you would like to bring to the class, please comment. Please DM me. Let me know if there's anything that I missed, anything that you would like for me to talk about when I do the New King James version of the Coochie Commandments. This is the Old Testament. This is the Old Testament of the Coochie Commandments. So maybe I need to do a New King James version. So let me know if there's anything that I forgot or anything that I should add in or maybe anything that I spoke incorrectly on. Like I said, I am not a doctor. I'm just a real bitch with a coochie. And, you know, I do my Googles and I know my body and I know enough to say enough. So if there's anything that you heard of value, take it. If there's anything that was not of value, leave the rest and leave it for someone else who may need it. But until next time, love you. Bye.